Doing well.
Thank you, so do you.
Thank you.
How are you today?
Pretty good, thanks.
Good.
I wonder what these postings, how many do they have? All the
Oh,
research projects. I wonder if anyone actually volunteers for those things.
I wonder.
Hey, I did that.
No way.
Yeah, I did a couple of them.
Really? You weren't
Yeah.
scared by it?
I was a bit worried at first, and it was kind of a little bit scary. There's a bunch of documents to do, and there's some things that, might be a bit uncomfortable. Like sometimes, like you have to do like an MRI, and I did one, and I'm kind of claustrophobic. Put some earphones on me and listen to some music, and it all worked out all right.
Well, that sounds like a time commitment as well. Like, how much time do they take up?
Well, it was interesting. There was like 3 tests that needed to be done for my study, and the last one that I did, and they did them all on the same day. So I was kind of in there in the morning, and by about 2 o'clock in the afternoon, I was out.
I'm a university student and I'm also working. Do you think there's any way I could participate?
That's a good question. There were a couple studies that I did that were just online survey questions, and then they called me and asked a couple of backup questions. But it was only like 10 minutes for the survey and maybe another 10 for the call.
I could
So you
do
didn't
that.
have to go in. You might be able to do something like that if you're really busy.
Yeah, sounds like something I would be able to fit into my schedule.
Cool. Oh, yeah, well.
And do you find it beneficial for yourself? Like, what kind of things do you walk away with?
Well, it's interesting. I was thinking about this, and as I got my movement disorder, and they gave me treatments that made me have a, better quality of life, and my symptoms are controlled. Somebody had to go and volunteer for the studies to get those treatments, and so I figured, well, you know what? Why not pass it on? And if somebody did it for me, I'm going to do it for somebody else.
Is there something for caregivers to participate, or?
You know what? One of the studies I was on, they were looking for people who didn't have the disorder, and they called them controls. And so they were doing a study on people who have the disorder, and then they won't do a study on the people who don't, and then they apply the treatment to both and see what the difference is, so they know, does this treatment work for patients with.
But don't the doctors head up these projects? Aren't you worried your doctor might, neglect you or something if you don't volunteer?
Well, that'd be pretty that'd be like forcing you into things, wouldn't it?
Yes.
My doc doesn't do that. I went to see this lady Taz, and she talked to me about this research ethics board that makes sure that the patients are protected, and that there's no pressure for anybody to go into any of these things. You don't get special care just because you are, which also means you don't get less than special care if you don't.
Good.
Well, it sounds interesting. It sounds like it might help.
Exactly.
So,
Yeah.
Julie, we're ready for you.
Oh, that's me. I gotta go.
Good to see you.
it's good to see you.
Bye.
Bye.
Take
Yeah,
care.
nice to meet you.